My name is Heather Butler. This is my informative speech, and these are my audience members. The general purpose of this speech is to educate patients on the types of hemodialysis accesses that are available to them. Now that you and your physician have decided that it's time to start dialysis, you will require more information to make an informed decision regarding the types of accesses that are available to hemodialysis patients. And to make that decision, you must first know what is available to you. Do you realize that in order to receive dialysis, you will need to be able to remove, clean, and return approximately 450 mils of blood in a single minute? If your kidneys are not filtering the toxins, they will build up in the blood, and without dialysis to remove those toxins, you could die. I graduated from Louisiana State University in December of 2005. I've been a nurse in the hemodialysis field since June of 2006, and for the past 2 years I've managed a chronic outpatient dialysis facility. Now that you and your physician have decided that it's time to start dialysis, you're going to need more information in order to make an informed choice of hemodialysis access. And to do that, you must first know what types of accesses are available to you. So you and your physician have decided that hemodialysis is the best treatment for you at this time. Now you will need to decide which access you need for your treatment in order to survive. First, we will discuss why you need the hemodialysis access. According to the American Kidney Fund, dialysis is a treatment for kidney failure. It helps replace the work of the kidneys when they have stopped working. In order to receive hemodialysis, you will need to go to an outpatient treatment center where trained staff will perform your hemodialysis. According to the Journal of Radiology Management, it states that to start timely, patients should have vascular surgery created 6 months prior to the need for hemodialysis. A patient cannot have a good dialysis treatment if they do not have a good dialysis access. The British Journal of Nursing reports there is early referral for vascular access, as without this, up to 75% of patients commencing hemodialysis need to be admitted for temporary vascular access, which can result in associated complications such as increased infection, increased morbidity, and even mortality. We've discussed why you need that access placed and when, ideally, it needs to be placed. Now we will discuss the types of accesses that are available to you. The catheter is a soft tubing inserted through the skin and placed directly into the blood vessel. Frequently placed in the upper chest or neck, tubing will extend several inches out of the skin. This is meant as a temporary access or used if a fistula and a graft are not options for you. You have a much greater risk for infection, greater tendency for clotting, and may be more difficult to get a good dialysis treatment. This is according to Fresenius Care North America. The fistula, created from your own blood vessel, it's frequently placed in the arm below the skin. Usually it has the least problems with infection and with clotting, according to Fresenius Medical Care North America. Our last option is the graft. It's created from a piece of tubing attached to a blood vessel, frequently placed in the arm below the skin. We tend to have more problems with infections and clotting as compared to a fistula, according to Fresenius Medical Care North America. We have covered the different types of accesses available to you for your dialysis treatment. Now let's consider what will happen if you choose not to have an access placed. The alternative: patients have the right to refuse to have dialysis, which would include not having an access placed. The National Kidney Foundation has a brochure that is available to patients, and this document is titled Dialysis Patients' Bill of Rights and Responsibilities. To choose this option, you must understand that not having the access placed will eliminate dialysis as a treatment. Your body will not be able to rid itself of the toxins that normal functioning kidneys eliminate. Your body will slowly and painfully start to shut down, and death will follow. I've discussed why you will need hemodialysis access, the 3 types available to you, and also the alternative of not having the access placed. Now that you and your physician have decided that it's time to start dialysis, you will require more information in order to make an informed decision regarding your choice of access. And to do that, you must first know the options that are available to you. The dialysis patient's access is their lifeline. Without it, you will not survive your disease. Thank you.